Physical therapy is an underutilized intervention for women struggling with symptoms of interstitial cystitis. This treatment offers an avenue for long-term relief and lowered treatment costs. Physical therapy is an interactive way to give power to patients to relieve their own symptoms without medication or surgical interventions, thereby improving quality of life.
Interstitial cystitis is pain in the pelvic region and around the bladder. Women describe interstitial cystitis as a pain or burning similar to a urinary tract infection. They may feel the need to void urine frequently and urgently. Voiding is painful and oftentimes low in volume. Symptoms may flare during menstruation, intercourse, and times of increased stress. Diet and exercise may also affect symptom severity.
Interstitial cystitis is found predominantly in women. 3.3 million women in the U.S. are living with this diagnosis. These numbers may underestimate the prevalence of the condition, given that it can commonly be mistaken for recurrent UTIs. Interstitial cystitis is often seen in individuals with fibromyalgia, chronic fatigue syndrome, and endometriosis. Stress, anxiety, and depression are also in association with the condition.
Interstitial cystitis should be regarded as a multifactorial chronic condition. Treatment approach must be reframed from the medical management model to the chronic care model. In other words, concrete evidence of bladder pathology may not be present. However, pain and impact on quality of life is real and should be treated as such. A neurological approach can be taken to desensitize and reconfigure pain perception.
According to the American Urological Association, first-line treatment for interstitial cystitis is patient education about bladder function and the condition itself. Behavior modifications such as diet, exercise, and stress management are also first-line treatments. Second-line treatments include manual physical therapy, pain management approaches, and oral medications. If these treatments fail, then scoping and surgical interventions are potential options.
Often, patients receive medications first without stress management education or physical therapy referral. And when medications fail to relieve symptoms, surgical options may be recommended. But surgery has the potential for scarring, which may cause further stress and pain sensitization and symptom flares.
Other than prescribing medications, physical therapists should be the first choice to treat interstitial cystitis. Unfortunately, medications tend to be first-line treatment instead of holistic, non-pharmaceutical options. Physician appointments don't allow for adequate time to address factors such as diet, exercise, and stress and pain management. On the other hand, pelvic floor physical therapists are fully equipped to handle the chronic factors associated with interstitial cystitis. Their allotted appointment time allows for adequate discussion and education for these patients.
Pelvic floor physical therapists can coach stress reduction via guided imagery, autogenic relaxation, and survey screening tools. Posture, exercise, sexual intercourse, and various hobbies can be evaluated for contribution to IC symptoms. Modifications can then be made accordingly. The symptoms of interstitial cystitis are often due to an increase in pelvic tone. Pelvic floor physical therapists utilize biofeedback devices to downtrain and teach patients how to reduce their pelvic tone. Additionally, manual physical therapy techniques are used to target internal or external trigger points in the pelvic floor region, as well as lengthen muscle contractures and mobilize scar tissue.
Studies show that manual therapy techniques are consistently effective in interstitial cystitis symptom reduction, with 70 to 94% of patients experiencing relief. Conversely, medications such as Elmira and Elavil, used to treat IC, take up to 3 to 6 months to take effect. Studies examining the medications have high dropout rates due to negative side effects. Research has mixed results on the efficacy of these medications.
So, you may be wondering how your patients can find a pelvic floor physical therapist. Head over to the APTA's section on women's health. Look for the PT locator under the Find a PT tab. Through this, individuals can locate a PT in their area that can help them with their specific problem.
Pelvic floor physical therapists should be recommended as primary care providers for interstitial cystitis. They are capable of providing the comprehensive care that these patients deserve.